My name is Laura Rodriguez. I'm the Florida organizer for Jews for a Secular Democracy. And welcome to our webinar, Health Under Siege, Sex Ed Erosion in Florida and Beyond. I want to thank you for participating. Please note that this is a 5013C space, and we need to be aware of how we're framing our comments. It will be recorded, so you can find it on the YouTube channel afterwards. And I'm going to let you, this is basically about the public school health education here in Florida, particularly sex education, is under sustained attack across the United States. Florida is serving as one of the most influential and instructive battlegrounds. Policies that restrict or distort sex education are increasingly justified through religious or ideological claims, raising serious First Amendment concerns and undermining both religious freedom and students' access to medically accurate, inclusive health information. Our experts tonight will help define the aggravants to sex ed, how their effects undermine our communities, and what are some of the ways that we can fight them. I want to thank our sponsors and co-sponsors, our sponsor, the Eula May and John Bow Foundation, our co-sponsor, Society for Humanistic Judaism, or Adam Congregation in Phoenix, Temple Beth Israel of Orlando, Congregation Beth Adam in South Florida, Florida Now, and the National Council of Jewish Women in Greater Miami. Please put your questions in the Q&A so we can address them towards the end. I'm going to introduce our panelists now. First, we have Takeata King Pang. She is the Executive Director of the Women's Foundation of Florida. She has 2 decades working in the realm of politics, advocacy, and activism. Takeata is a steadfast force for social change, from orchestrating campaigns around the country to assuming pivotal leadership roles in her hometown of Palm Beach County. She has dedicated herself to advancing causes like women's equality and racial justice. Following impactful roles at Planned Parenthood and as chief of staff to a Florida senator, Takeata took the reins of Women's Foundation of Florida in 2019, overseeing a period of remarkable growth, doubling its reach and impact. Armed with a master's in political management from George Washington University and a bachelor's degree in political science, communications, and theater arts from Stetson, Takeata embodies a potent blend of expertise, passion, and unwavering dedication to effecting tangible change. Pascale Alcindor, I hope I pronounced that correctly, has dedicated over 20 years to improving the health and well-being of young people, to include teaching adolescents, developing and leading innovative student-centered schools. Since 2010, Pascale has provided capacity building and evidence-informed guidance to education leaders seeking to implement effective sexual and reproductive health education programs. Pascale is a co-founder and membership chair for the Florida Healthy Youth Alliance, a statewide coalition of medical, research, and educational professionals who champion the health and well-being of Florida youth. Pascale earned a bachelor's degree of science in human development from Cornell University and a Master of Science in Public and Urban Policy from New School University. Dr. Amy Weiss is a professor and chief of the Division of Adolescent and Young Adult Medicine at the University of South Florida Morsani College of Medicine. After receiving her medical degree at Columbia University College of Physicians and Surgeons, Dr. Weiss completed her pediatric residency at Vanderbilt Children's Hospital, followed by a fellowship in adolescent medicine at Children's National Medical Center. In addition to patient care, she's active in medical education and advocacy work. In her free time, Dr. Weiss enjoys spending time with her husband and 2 sons, who are avid baseball players. She and her family love to stay active together, golfing, surfing, and skiing. Jaclyn Friedman is the founder and executive director of EducateUs, A lifelong activist, advocate, and organizer, Jaclyn's work has globally popularized the affirmative consent standard of sexual consent. Her first book, Yes Means Yes, Visions of Female Sexual Power and a World Without Rape, was one of Publisher's weekly top 10 100 books of 29. She has inspired new laws in 5 U.S. states, as well as policies on countless campuses across the country and the world. She also spearheaded the legendary hashtag FBRape campaign, which forced Facebook to address and exclude content that promotes and trivializes violence against women under their hate speech policy, and is founder and former executive director of Women, Action, and the Media, WAMI, WHAM apostrophe. I'm going to sort of pose a question, discussion item to our panelists in kind of as a group question. I'm going to start with Pascale, actually just directed toward her. The Florida Healthy Youth Alliance emerged in 2021, and what gap existed that made a statewide coalition necessary rather than a bunch of individual organizations working alone?
That's a great question, Laura. Thank you. Thank you for having us today. There were multiple factors that influenced the emergence of Florida Health Youth Alliance as an alliance as opposed to a single organization. But before I can actually share that, I got to tell you what happened in Florida between 2015 and 2020 that sort of moved us towards Florida Health Youth Alliance. Between 2015 and 2020, Florida actually experienced the greatest surge of resources, supports, and focused intention towards comprehensive sex ed in the history of the state. By 2020, I was working with multiple school districts who either were planning on creating a comprehensive sex ed program or had one or were very intentional about moving in that direction. So it was really a wonderful time to be working with school districts in Florida at the time. Why that was is because Florida Department of Education at the time had the Healthy Schools office, and the staff there were super supportive of sex ed. They made sure that schools understood the value of comprehensive sex ed, and they provided the resources to help them get there. There was a robust website with actual toolkit on implementing effective sex ed. We actually still have that toolkit. Healthy school staff provided training, technical assistance to schools, and they helped them adopt a better sex ed as they were prepared to do so. And my job at the time was to work with the school districts to help them get there, providing training and technical assistance. And there were other schools who either wanted just the information and have the training perhaps in later time, and some schools just wanted to go full bore towards comprehensive sex ed. As a matter of fact, the Office of Healthy Schools even highlighted the Advocates for Youth 3Rs curriculum, a well-established comprehensive sex ed curriculum, in the March 2019 newsletter that they distributed to all the school districts. So they were fully committed to comprehensive sex ed, and they were moving in that direction. I was invited to speak in 2 occasions, 2019 and 2020, to make sure that people understood that I was a resource. I was available to them and I could help them move towards using the 3Rs curriculum or whatever other comprehensive curriculum that they wanted. At the same time, we also had a surge of resources from CDC, from the CDC DASH grants. The Division of Adolescent and School Health had a cooperative agreement with six school districts in Florida. And those 6 districts had an opportunity to get resources, to get training, to get a lot of rich guidance towards comprehensive sex ed. So that time period was a heyday for sex ed in Florida. Now, everything changed in 2020. So this is where it gets sad. The Department of Education at the time had 2 leaders who were champions of sex ed, the director of Healthy Schools, as well as the Family Life and Disease Prevention Coordinator. Those 2 people left and retired at almost the same time, one in August, one in December of 2020. The position of family health and disease prevention was never actually rehired. They never rehired for that position. and the director at the time that came on board was very hesitant to support sex ed. Also, there was a removal of all of the DOE resources that were on the website. So the toolkit no longer was available to teachers and to schools who wanted to move towards effective sex ed. At the same time, there was a proliferation of seemingly grassroots town hall meetings across the state in different counties that were influenced by national funding that focused basically on politicizing sex ed. We were getting calls from school districts saying there was a meeting and people were saying sex ed is basically porn, and that Advocates for Youth was a peddler of porn, or different organizations, and we should not. And there was a lot of fear. We also saw groups such as Moms for Liberty and County Citizens Defending Freedom going to school board meetings, and many of them possibly posturing as parents. Many of them were not parents in those schools. And they made very clear that sex ed was not on the agenda. That should not be on the agenda in school districts. And many of our school district board members were fearful, quite honestly. This is a time where many school districts had security actually escorting board members to their cars. By late 2020, there was really, quite honestly, a quick and seismic decline in the support for sex ed, where pressure for school districts to literally shift from the pressure to the anti-masking pressure to anti-sex ed, to anti-LGBTQ+, to anti-trans. All of that happened pretty much very quickly within months. And it was very heartbreaking to watch as the folks who were working with me in the leadership roles who really supported sex ed knew that they were no longer supported by the state. And it was obvious because they didn't have the resources from the state DOE website. They didn't have anyone speaking to them about how to move forward and through some of the attacks on sex ed. And quite heartbreaking to have a lot of our school districts literally turn away free resources, training, and support for sex ed. Many of them were already on their way. Some of them had already implemented very robust curriculum. And at that time, there was no one organization in Florida that really focused on sex education. And from my previous work in Georgia, I knew that there had to be a focused organization that really pushed the agenda and helped school districts to understand that they have the opportunity to provide the most robust sex ed, and there were resources available for that. So 2020 was a very disheartening year for sex ed, and was very concerned that we would not be able to salvage all the work that was done to really build up sex ed from 2015 to 2020. So I called on Dr. Alyssa Barr from the University of North Florida, Brooks College of Health. And I called other colleagues in the field of medicine, HIV/AIDS, and anyone I could talk to and say, we need to do something, because there's a gap in the resources and the supports that teachers need to move forward with robust sex ed. And we know from the statistics and the data that we've collected in the past that Florida really needs robust sex ed. So we started at the time the Florida Health Youth Alliance, and we were able to bring on the Women's Foundation as an organizing group. And Takeata joined us at the time. Our funder was able to support us in getting Takeata on board. So at the time, we wanted to make sure that we could solve the problem of, one, the resources that would be available to teachers, to school districts, to leaders, to make those right decisions for young people. And we created a website almost immediately. Literally, it was a dumping ground of information from the DOE Healthy Schools website, and then other resources that we knew of, we were very familiar with and were well respected in the field of sexual health. We also had a coalition of like-minded professionals who were wholeheartedly supportive of sex ed and were publicly advocate for sex ed. And then we had content area experts and validators who would go to school boards and say, hey, you're doing the right thing. Keep going, move forward, don't worry. We're here with you. We understand the medically accuracy is important, and that we also know that young people need this work, and we're here for you. And because otherwise they would hear only the attacks, they would not hear the positive voices. We are also very clear that our organization would be one that would be supportive of any and all organizations or all ground roots efforts, real ground roots efforts to provide sex ed. So this is why Florida Health Youth Alliance was created. So out of that vacuum of resources and supports, we came in and said, let's provide that. And we are intentional about creating a true infrastructure for sex ed in Florida. I hope I answered your question.
It was perfect. Thank you so much. And I appreciate the work that you guys are doing. And it sounds like it's more than a gap. It sounds like there was a chasm that was created,
Right.
much wider than a gap. Thank you. In the next question, I want to add Takeata and Dr. Weiss in there. How does the FHYA, I mean, you explained it a little, how are you really trying to solve some of these problems, and what is the approach, how is it different from other organizations in the classroom, and why is it important to include medical education and medical educational research professionals in the group rather than it just being a single issue advocacy group? So I'll let the three of you sort of tackle that in a discussion.
Well, I think Pascale did a really great job of really explaining what we were trying to solve, right? The idea was that sex education needs to happen in schools to reach the largest amount of students and have the most effect on public health in general for adults as well. And so our focus is very narrow, specifically to the provision of sexual health education within the school system. That is our goal, is to get it in the curriculum back into our schools robustly. And that is a little bit different. We are not just saying sex ed in general. A lot of the sex ed providers, those certified sexual health educators, they are now, because they're not able to be in the schools, are providing sex education in the communities, which is very important and needs to happen. But the reality is that it reaches an incredibly slim amount of the students compared to what we can do in the schools. So that is like the biggest difference in how we're approaching this. But I think our focus in really relying on our medical education and research professionals sets us apart in a lot of ways. Mainly because, and I was just talking to a school board member in a meeting today who said, you need to talk to the pediatricians. They're the ones parents trust. The doctors, those are the people. And so with that, I'm actually going to turn the Zoom over to Dr. Amy Weiss to talk a little bit about why it's so important for folks like her to be involved.
Thank you, Takeata. And again, thanks for having us. I've heard that recently a lot in the context of vaccines, which has been a topic of discussion in Florida as well. I know that's not what we're talking about tonight, but the pediatricians as trusted resources around the vaccine issue keeps coming up in a lot of conversations that I've been having. But back to the Florida Healthy Youth Alliance, I think it's important that we have a coalition of medical research and education professionals because, again, we really are the trusted experts in our communities and in our fields. And we want to be that valued voice for the elected officials, for the leaders, for the administrators, for the school board members and the staff at the district level, and really any other community member when they are seeking information, particularly evidence-based information about health education and sex education. And I think that our professional experience really gives us credibility and that we can have these challenging conversations and speak in a respectful and non-political way about the needs of the youth in our communities.
Thank you. Takeata or Pascale, did you have anything to add? Okay. Jaclyn, why is sex ed so important, and what makes quality sex education? What are some of the misconceptions that in public conversations about what they have about sex education, what gets left out, what gets left in, etc.? Maybe you can give us some of that information.
Sure, I'd love to. I am going to drop in the chat a one-page overview of the National Sex Ed Standards, and I think this is a great way for people to understand when we're talking about sex education, the kind of range of topics that we're actually talking about. Because one of the misconceptions that we do see is that most people, when you say sex education, think about the sex education they got, which was in all likelihood either very inadequate and incomplete or actively harmful. And so it's a real challenge making sure that when we talk about sex education to convey the fullness of what we're talking about healthy relationships, boundary setting, consent, knowing who's an askable adult, right? Like anti-bullying curriculum. Like there's a whole lot of stuff in sex education that's not sort of putting a condom on a banana or making people feel shame, which is most of the things that people get associate with it, unless they've heard misinformation from opposite opponents of sex ed, in which case they believe even more out there things, which I think have already been referenced about pornography. And, I've heard things like, diagrams of like the human body referred to as pornography being taught under the guise of sex education, which how on earth do you teach sex education without teaching about the names of parts of the human body? And in fact, when you do teach names of parts of the human body, you increase young people's ability to report if they're being abused, FYI. So sex ed is important for so many reasons. We tend to go to the individualistic reasons, and they are real in terms of reduction in disease transmission, reduction in unwanted pregnancies, those sorts of things. But the reality is, like, I really always challenge people to think, like, what if everybody on the Supreme Court had better sex education, right? What if all of our judges and doctors and police officers and all the people in power positions who we deal with all the time had better sex education? What if we had lived in a world where a generation of young men grew up knowing how to handle rejection in nonviolent ways? Even that just one change would be transformative for this country. Sex ed has really big ramifications, not just on the individual, the individual young people we're talking about, but all of us are impacted by the sex education that young people do or don't get. And I really think that it's important to talk about who is most affected, right? So when sex education isn't taught or it's inconsistent or it's shame-based, what happens a lot is that the young people who are most vulnerable bear that burden disproportionately, right? Because let's just say, like, straight white young men, right? Like see themselves reflected all over the culture as sexual actors. Now, they may be getting sort of a toxic idea of what it means to be a sexual actor, but they're centered in a lot of information. It's not hard for them to find information. We see that the disparate impacts are on girls and women, queer and trans students, students of color, students who are already marginalized when they don't get talked about, when they don't learn that it's their right to say who is and isn't doing what to their own bodies and how to actually express what they want and don't want and navigate those relationships. It's really leaving them very vulnerable to abuse. And so sex ed is essential for all of our communities. It's fundamental if you care about LGBTQ rights, if you care about reproductive freedom, if you care about ending gender-based violence, if you care about communities that know how to resolve disputes in a healthy manner. Sex ed is fundamental to all of those things.
Thank you. I had sex ed in school like 100 years ago, and it was very focused on the physical things. There was no conversations about relationships and that kind of stuff. It was very, this is this part and this is that part and this is where this goes and that kind of thing. So, but you're right, it's much more than that. So thank you. Takeata and Jaclyn again. So we'll talk about current sex ed policies here in Florida, which are getting more and more non-existent. So what does the school districts versus the state legislature play in determining educational content? What about the vagueness of some of those policies? And how does Florida compare to national trends?
Yes. So unfortunately, Florida tends to set national trends. So a lot of the really horrible stuff starts here. They test the waters. They perfect it, pass it, and then move it on to other states. Though we've had a few things that we were able to kill that still went on to other states. So here in Florida, as Pascale gave a really great overview of kind of like 2015 to 2020. So starting in 2021, they actually passed a piece of legislation that mandated sex education curriculum be reviewed at a public school board meeting and then be publicly approved by school board members. So at that time, school districts were responsible for determining what curriculum they chose to use, whether that was abstinence only, abstinence plus, or a quality comprehensive curriculum. And so the state legislature decided that this needed to happen more out into the open. This was very much because of those Moms for Liberty and Citizens Defending Freedom town halls that were happening. And so that bill passed. And so school districts then had to post their curriculums online for the public to be able to review. And then they had to have an open meeting where anybody could come and speak. And we, Pascale and I, especially, we were circling the state. We were at a lot of meetings, Pascale, especially on the ground, meeting with school district members and school board members and emails. And we rallied folks in about 6 different counties, almost 7 actually, because I always forget about Polk. And we really had a lot of medical education professionals, parents, and youth really rise up. They were showing up to the school board meetings, and they were able to help the school boards decide to keep comprehensive curriculum. We were successful in keeping comprehensive sex ed even after that first piece of legislation that was like, now you have to do this out in the open. And I will say our opponents, the Moms for Liberty and the County Defending Freedom folks, they would send in hundreds of petitions, but 2 people would show up to the meetings, and they were combative and often required to be removed by security. They tended to be very angry, but not actually from the communities that they were in. We were showing up with dozens and dozens of community members, medical professionals, students in those school districts, and it really had an impact. We were able to show the schools, the leadership of school boards, that this was something that was wanted by the community and needed by the young people. And we were so successful that they then created new legislation that passed in 2023, the infamous HB 1069, it will never leave my brain, which basically took all control over determining your curriculum and moved it to the Department of Education. It tasked the Department of Education in creating a process to review and vet the curriculum for each of the 67 school districts in the state of Florida. It also asked them to define what is medically accurate and age appropriate for Florida standards. And so the bill passed, it went into law. They told school districts, you can't do any sex ed until it's approved by the DOE. And then they waited. There was no process. There was no, hey, this is what you're going to do. They waited. And so we as a coalition started putting on pressure, like, where's the sex ed? What's going on? Over a year after the bill passed, no, almost a year after, it was in September of 24, the school district got an email from the state saying, quick, in the next 3 days, you have to upload your sexual health curriculum for approval. So first of all, they had no time. They had been given no guidance or guardrails, again, of what medically accurate and age appropriate is. Now, we have like medical scientific definitions of that, but they are not valid in the law. The law says that the Department of Education gets to create those standards and define what that looks like. And so all the school districts, work and rush and get things submitted to the Department of Education, and then crickets for 9 months. So now we're looking at 2 years where sex ed is legally not allowed to happen because of the rules that were passed by our state legislature. And the school districts are dealing with lots of other things you can imagine in the post-COVID world. So this was not them banging down the school district's door saying, hey, how do we do this? And so it was just this very quick cutting off of the knees for the districts that were trying to do real sex education, quality, comprehensive. And then since then, the fear and the frustration of not knowing what the process is, not knowing what is and isn't allowed, and the Department of Education in 1069, the very last line of the bill, gives them rulemaking authority to implement this new law, meaning that they can set laws or set rules around how to implement this piece. In that sense, I guess they decided they didn't want to set any rules because they will not put anything in writing. There have been no actual policies, procedures, or SOPs provided. The information that is given back, feedback on curriculum of what you can and can't do, has all been over the phone. Like literally one-on-one phone conversations between someone at the DOE and a mid-level staff person at the school district. And things like being told they couldn't use images of the uterus and ovaries. They couldn't use the word fluids. I'm not sure how you do HIV/AIDS education without the word fluids, or why it's a dirty word. So they were giving and then every school district was getting something different. There is still no, and that's where we are today, right? There is still nothing. And then we are looking now in our current state legislative session, which is currently on day 31, so a little bit over halfway. They are trying to pass legislation that will implement, ironically, fetal development video mandatory for K through 12. So this same video should be shown to kindergartners all the way through 12th grade, and it has to be created by AI. So interesting. And then they said that the DOE is responsible for ensuring that it is quote unquote medically accurate. This bill has flown through the House. It has not moved on the Senate, knock on wood, so we're not sure it'll go through. The Senate version of the bill includes what we call an opt-in, which means that students would have to, their parents would have to physically sign a form or online opting them in to receive sex education. And when opt-in is put into place, we often see a humongous drop off of students who are now eligible to receive sexual health education, to the point of 60 to 70% will not return this form. So an opt-in would essentially end sex education for the vast majority of the state of Florida. Though again, just remembering it hasn't really been happening in the robust way that it used to here in the state. So that is the lack of clarity, the crazy legislation. It has been an interesting game of, working towards keeping sex ed, having the community rally, and then having the state just basically say, nope, our Department of Education is in charge of everything now. And for those who may not be aware, the Department of Education is run by an individual who's appointed by the governor. So there is no checks and balances or elections there that can be utilized. And they've also taken over the State Board of Education, which is appointed entirely by the governor. So that's the state of Florida. But Jaclyn, I'll let you talk a little bit more about.
It sounds like that last sentence just lets them do nothing.
Yes. I mean, I will say, Florida, as far as I'm aware, and look, I'm not chapter and verse on all 50 states at the same time, but as far as I'm aware, this innovation that Florida is bringing to the table is this sort of creating state control as a means of doing nothing. There are certainly other states that have state control mandates about what should or shouldn't be taught, but they are made explicit. And some of those are good, right? California, Illinois, New Jersey have great mandates on the books, and then other states have harmful mandates on the books. Mandates can range, but using a mandate of state control as a way of making it impossible to teach sex education is an innovation that Florida can boast, I guess. In terms of how other things that are happening around the country, that bill that you're talking about, the fetal ultrasound AI bill, is informally called the Baby Olivia bill, because that's what the video that the folks behind this bill, which is being run in many states and has already been passed in a few, call the AI fetus in the bill. That bill is going like wildfire in any state they think they can get it passed in, and some states that they're never going to get it passed in. Another thing that we're seeing is not, as far as I can tell, hit Florida yet, which is something called success sequencing. You see this in also addressed in the new Heritage Foundation report that they just put out about how they're going to run the next 250 years of America by taking back the family. And success sequencing is the very upside down idea that you can create economic thriving in individuals by making them follow a specific sequence, which is graduate high school, get a job, get married, and then have a baby in that order. Um, it comes out of data that correlates that order with economic thriving, but it gets the causation completely backwards, right? Like it's much easier to do things in that order when you already have economic advantage. But what they're saying is if you follow this very narrow path that like, yeah, has anyone looked at the job market recently? If you follow this very narrow path that like you are going to be successful in life, and of course they mean heterosexual marriage, they only mean heterosexual marriage. And so this is sort of what they are pushing in a number of states as a replacement for actual sex education. I would say Baby Olivia and success sequencing are the biggest negative trends we're seeing around the state. I do want to share, SECUS has a wonderful legislation tracker that they just launched. So I know there are people here who are not just in Florida, and if you want to see what legislation is moving in your state, you can take a look here. It's a really great tool that I am a fan of. Um, I mean, I see a question in here about sex education debates and broader Christian nationalist policy goals. And I think that I maybe just answered that by referencing the Heritage Foundation, which is an engine of Christian nationalism. Yeah, it is absolutely the anti-sex education forces are absolutely driven by Christian nationalism. Just like so hand in glove that it's hard to disassociate them. I will say that it's because of a lack of leadership by secular and uh, at least not secular individuals, but individuals that believe, like I do and we do in this room, in a secular democracy, right? That we've seen from the Christian right decades, starting with Reagan, a push for abstinence propaganda, harmful, controlling propaganda in lieu of actual sex education. And there's been, until recently, no response to it. Or because a lot of people who should stand up to it have felt like they don't want to be associated with telling kids to have sex because that's one of the mythologies that's around sex education, which of course it is not doing. And there's a lot of research that shows that it doesn't make young people have sex sooner if they get sex education. That's just not a thing. But they smear it with that, and then uh, mostly male politicians who should know better, fall for that and don't fight as hard as they should. So yeah, it's absolutely part of the Christian nationalist agenda, like 100%. And that's also why it has so much money behind it, quite honestly. I will say that there are positive trends for sex education in some places. There are places where we're doing implementation fights where they've already managed to pass mandates. I mentioned some of those states. There are also states like Michigan and Massachusetts that have managed to really improve the standards through the Department of Education administratively without having to pass a bill. So we're finding in some states that are a little more friendly that you're able to get things through sort of administrative processes without having to go through the state house. There's movement in the positive direction as well. Although we're not able to do that in Florida right now because the state house has a stranglehold on every district.
Yeah, we are definitely in a super majority. Thank you. Now this is for Dr. Amy and Jaclyn. Just connecting the policies to actual health outcomes, for young people, for the community at large. How do these policies really on the ground affect, young people and the rest of the community that they're part of?
So I'll start, I guess, by talking about the individuals, and then I think Jaclyn will speak more to community. What we're seeing really is just a shortage of information. Young people are just uneducated about their health in general and about sexuality and their sexual health. about their bodies, all these things, how their behaviors influence their health. And they're turning to sources mostly like the media, social media. TikTok is a big one that I hear about. A lot of our youth are turning to TikTok. There's a lot of health, I'll put it in quotes, information that young people are getting on TikTok. And so, I'm spending a lot of time debunking myths, debunking misinformation and disinformation that youth are finding online. We talk about, all kinds of things in our clinic visits, everything from anatomy, like we've talked about already. Kids don't know what's normal, what's not normal. Periods, again, like what is normal, what is not normal. All kinds of debunking myths about birth control. It's not just for preventing pregnancy. There are a lot of uses for it. And we talk about all the different types of birth control and what they might be useful for. Lots of education about how do you get an STI? You can get an STI in any part of your body that you're using for sexual activity. So most youth who walk into my office don't know that they can get chlamydia or gonorrhea in their throat if they're having unprotected oral sex. And so lots and lots of time is spent educating about how to have safer sex if they are going to be sexually active. What's a healthy relationship look like? What is consent? Are you in a healthy relationship? Lots of kids are meeting people online and having relationships with these folks that they've met online and talking about, is that safe? Is that person who they say they are? Do you know that for sure? Do your parents know that you're talking to this person online? So, I mean, the whole range of conversations comes up in clinic visits, and thankfully, youth are share. They share. I often tell my medical students and residents when they come spend time with me in clinic, you just ask an open-ended question in a non-judgmental way, and a teenager is going to tell you more than you ever want to know. You are going to hear things that you wish you never heard. They are very open and honest with us in the doctor's office, and so it is a good time to educate. But again, it's just one-on-one conversations that we're having, and so really we're not reaching, all the youth that really need this information.
Thank you.
Yeah, and I would say a lot of this has to happen in one-on-one conversations when the schools want to it. So I think it's important to point that out. We all have the power to do that with the young people in our own lives. I already talked a little bit about some of the community impacts of having or not having sex education, but I want to lift up a couple of more. One of the most effective messages that we found in terms of talking about sex education is based on research that found that schools that teach the kind of sex education we're describing have a reduction in bullying in the school environment, an overall reduction in bullying, and an increase in bystander participation. So young people are less likely to bully each other, and if they see somebody being picked on, they're more likely to step in and stick up for that person. You can imagine in a country where there are a lot of bullies running wild right now, how that, over time could change the culture of an entire community or even an entire state, if we were to reduce bullying in schools. It's also something that's absolutely true that young people are more isolated than ever. They're sort of stuck in their phones. They don't know as well how to socialize. They haven't fully recovered those skills from lockdowns. And sex ed, talking about and teaching healthy relationship building skills is a real strong antidote to those things. And again, you can imagine it's not hard to see how that's going to affect what the culture we all live in, whether we are young people, whether we know young people who are school age right now or not, the culture that we all live in, whether those kids get those skills or not, is going to impact all of us.
Thank you. I was thinking I'm up here in Tallahassee advocating with Planned Parenthood, and one of the bills is it's called parental rights, but it's the opposite basically. It's that the parent has to opt in for the student to learn about STI, et cetera. But what I find kind of ironic is that, as Takeata was saying, they're not really teaching anything. So what are they opting in for if it doesn't exist? So it's
I'm quite surprised to hear that they're working on opt-in because they're not teaching anything. Yeah.
Right. I find it really ironic. I'm like, I was kind of laughing when I was thinking about it. I was like, okay, they have an agenda, that's for sure.
I do think I just want to throw in, since you brought up HB 173, the parental rights bill is pretty ironic because it believes that parents should have rights over youth's health and medical well-being. And so it's actually taking away young people's ability to access any type of medical care without their parent not only providing consent, but being in the room and being privy to all test results and all information. And I imagine, Dr. Weiss, if you want to comment on this, that this children are going to not have the ability to ask the questions they need to.
This is the second year that they've introduced this bill, this parental rights bill in Florida. We were able to successfully defeat it last year, and it's going to change the entire way that we practice medicine in with this age group of youth. It is going to be so harmful to these young people. This bill will, I mean, I can't even state how much harm it will do. Yeah, to have parents have control and have to consent for all healthcare for youth. Kids are not going to come to the clinic or the office. They're not going to be honest. They're not going to tell the doctor what they're actually doing, what's happening. And so I think diseases are going to get missed. Illnesses are going to get missed. Diagnoses are going to be delayed. And so much harm is going to be done to these youth. I can't overstate that. It's extreme.
It's very scary. We had a couple of high schoolers with us, and they come from, they're in families where they can actually talk to their parents, but they even said, like, I can't imagine that I couldn't talk to my doctor about whatever I wanted to talk to, without my parent being in the room. Speaking of advocacy and moving on, Pascale and Jaclyn, considering what we were just mentioning, what are some of the most effective ways we can challenge some of these things and move forward?
I'll start. I want to share that with Florida Health Youth Alliance, sort of our approach to building the work and building the infrastructure in the state dictates what strategies we use. We're really clear about being hands-on in providing support, resources, and expertise to folks on the ground, but being very hands-off about how it's executed. We're clear that we're not the experts in any given community of what's going on, what works well, and who are the players to engage. So we have work groups in each of our districts that we engage in, and those work groups are include parents, organizations on the ground, youth groups, as well as even district folks who want to be involved in some way. We do a lot of the work in the background to help them get the resources, the talking points, to understand what the policy is. And we help them in terms of helping to create their story and provide testimony at school board meetings. But we never, ever, ever come instead of a group. We never come as Florida Health Youth Alliance is here to present and our opposition to this. No, it's always an organization on the ground doing the work, and we're in support of them. We provide the expertise, we provide the training, we provide everything else. And we're always welcome. A lot of our members are there for testimony as well. Amy has been one of the best testimonies I've seen in Hillsborough County Schools. But we join the testimony, we get out of the way as much as possible. That has been very effective because we're 100 strong, but if you think about the vastness of the state, we have to make sure that as a volunteer group, we're able to get to the places that really need our support. And in order to do that, we look for the folks on the ground to tell us exactly what's going on. And we have a lots of support from local folks who will tell us what is the need, what's happening, and we go there. Now, before the local control was completely removed, we were very instrumental in getting to the school districts, being there very early, being prepared, having young people who wanted to tell their stories, having the parents there, having community folks there who were very prepared and ready to provide testimony. This is why I remember in Miami-Dade, for example, we were told they voted against, they were moving towards voting against having sex ed in the schools. And one of the leaders, one of the board members said, wait a minute, you have 90% of the folks here are for sex ed, are here. And so why are we voting against it exactly? these people actually are the ones who represent the community, as opposed to the very loud folks who were there, who were opposing it and combating, very combative in the meetings, but were not really necessarily the parents. They were not the students. They were not the people who really were going to be affected by the policies. So we were able to overturn that policy in Miami-Dade, and they did adopt the curriculum. That was one of the best days of our work. But we are also very mindful about providing the expertise when needed and being present as needed. So that is our strategy. And because we're small, like I said before, it's very difficult to be everywhere at once. But we're very effective by being there when needed in the school districts.
We had a similar experience in a committee hearing about a DEI bill. And almost, I would say, there was only one piece of testimony in favor of, it's basically a county not getting funding if they're going to support DEI or whatever, or city or other. And
Yeah.
they had so many waves in opposition and so many testimony in opposition. And what did they do? They moved the bill forward. So the opposite of what the entire room was saying.
Right.
Same,
Yeah.
you know. And people were asking me, how can they do that?
Yeah. What we also do is we work very closely with the school districts. So we have meetings with the school board members. We have meetings with the school leaders. We help them understand the impact of some of the decisions they're making. So we take a lot of time to build relationships in schools. So that we're not just yelling and saying, hey, you need to do this. We're also making sure they understand how to do that and why it's important to do the work that needs to be done in terms of really adopting comprehensive sex ed. One great story ever, again in Miami, where we had a large group of young people who were advocating for sex ed for years. They were there, and they was just really phenomenal group of young people. And when I went to Miami and approached them about working on moving towards comprehensive sex ed, they were like, so we were at meetings many times. What is comprehensive sex ed? So they heard it, they heard the loud noise about it, but they didn't know what that meant. So I literally walked them through, and people may not know this, but Miami-Dade County Schools actually adopted a comprehensive sex ed curriculum back in 2019, actually. They signed the MOU in 2019, and they were moving forward. And the DOE was very excited about that, and they were very supportive of that. So understand that our approach is really, really hands-on when it comes to helping districts to make the right decisions for young people.
Thank you.
I don't know. I think
Jaclyn?
Jaclyn has some more she wants to
I mean,
share.
I'm going to sort of, because I know we are short on time, going to jump into I'm going to blend into the next question. So I would say the number one mistake that we see people make when they want to become advocates on this issue is that, and I think Pascale, you already handled this, is that you sort of want to yell and scream. And I really respect people who want to yell and scream. I'm a person who wants to yell and scream a lot, but it is not an effective way to change people's minds and get them to change their behavior, nor is just reciting a bunch of facts and figures. If reciting a bunch of facts and figures was going to get the job done, we would have won decades ago, because the facts and figures have always been on our side. If you want to get people to do something that they weren't already going to do, you have to make them feel something. So in the interest of time, instead of going deeply into what I mean, I'm going to drop the guide that we wrote with the messages that we have researched and tested about the way to tell a story in your own words about sex education that people can really hear. And it has our tested messages as well as advice about sort of speaking up for sex ed at a school board meeting or the like. And that is actually one of my number one pieces of advice for like a concrete action you can take. And if everyone wanted to do one thing right now, the thing I'd love you to do is use the tool that I'm about to drop in the chat and ask us, when you fill out this tiny little form, it's so fast. We will look up your school board members' email addresses, send them our guide explaining what sex ed is and how to advocate for it in their school district, and introduce them to you, their constituent, as someone who wants them to support sex education. And all you have to do is tell us the basic information so we can figure out what school district you're in. And literally so much of this happens. I know we're talking about how things are hung up at the state level in Florida. That is not going to be true forever. If they thought it was going to be true forever, they wouldn't be pushing opt-in. Let me just say that, right? If they thought they were going to have a stranglehold forever, they would not be trying to pass opt-in. So building those relationships now with school board members, whether you're in Florida or somewhere else, whether you think movement is possible right now or not, making sure they know this is an issue their constituents care about is the number one most effective thing you can do. It may be that your representatives in Tallahassee or whatever your state house is you don't feel like they're responsive to you, but school board members need to get reelected, and most of those races, unless you live in a big city, turn on very small margins. And so hearing from a few of their constituents that this is an important issue really can start to put pressure on these folks and at least open a conversation. So I just dropped the link to our school board guide. If you fill out the little form on our website, we will connect you to your school board member. You don't have to look up and figure out who their email addresses are, and send them our guide, including a menu of model policy. Some of it is like a big thing. Some of it's just like, what if we started with puberty education or HIV prevention education or consent education, or small pieces of it that you could get past that don't sort of trip all the political censors in the same way, depending on your community. And then I'll also just say, Educate Us, we're here for the entire reason I created Educate Us is to help folks like the ones on this call advocate for sex ed effectively in your community. So if there's ever anything we can do to help, just shoot me an email. So I'll turn that back over to everybody else if you want to also add other action steps. But my main pitch always is get involved in your school board.
Thank you, Jaclyn. Anybody have anything else to add about advocacy? I see just a couple of questions in the Q&A. One is about how sex ed can help our young men with their growing needs, so to speak. That those might be a little stronger than young women, and how sex ed can help them navigate that. And what if I'm understanding this question correctly, that maybe it's the assumption that the child wants the vaccine, the education, medical test, etc., but the parents don't, and magically there's no more concern about parental rights, right? So those were the two questions in the Q&A.
So I can speak to the second question about the parental rights and stuff. So vaccines, well, I'll speak to the state of Florida because that's where I practice. Vaccines are separate from some of this other stuff that we're talking about in the state of Florida. You need parental consent to administer any vaccine in the state of Florida. So we cannot give a vaccine to a child without signed parental consent. So that's a little of a different, it's a little different than some of the other stuff we're talking about. Adolescents have certain health things that they're protected against, so that they have a right to receive confidential health care for, basically. And it varies slightly by state, but in general, across the country, most adolescents are able to receive confidential STI testing, treatment, pregnancy testing. Most states, adolescents can receive care if they become pregnant, things like that. And so that's really what this parental rights bill that's being proposed in the state of Florida is really potentially damaging for. So in the parental rights bill in the state of Florida, if it passed, teenagers could get, the way they did a little carve out last year is teenagers could get tested for sexually transmitted infections without parental consent, but would require parental consent to get treated in the case that they were positive for a sexually transmitted infection. So that's where the danger really is. When I was speaking to the danger, for example, a teenager comes to see me, we ask parent to step out of the room, which is what we routinely do. Teenager says, I am having sex. I would like STI testing. We do the testing, comes out, they have chlamydia. Now I can't treat that teenager without then calling the parent and having the parent come back in and give permission. So now the teenager is walking around with untreated chlamydia, passing it on to whoever else in their community, and also suffering the consequences of not having their chlamydia treated, which can cause medical consequences in males and females. So some of the protected adolescent rights to healthcare are what are being attacked under this parental rights bill, which is a little separate from vaccines.
Thank you for the clarification.
I would just say to the other question, just briefly, like, I wouldn't agree that teen boys necessarily have stronger urges than any other gender, but good sex ed absolutely helps teenagers understand all the weird feelings that are happening in their bodies, whatever they may be, whether they're feeling strong urges or whether they feel like everyone around them is feeling a strong urge and they're not. Sex ed is really important for helping them understand their own context and that the bodies are all different and all of those differences are fine, and how to handle them in healthy ways that don't hurt other people.
Thank you. Okay, I'd like to thank everyone for joining us this evening. Thank you to our panelists. Thank you to our sponsors. As I said before, this was recorded and will be available on our YouTube channel. And I hope everyone feels a little bit more empowered. Follow that link that Jaclyn put in and find out what's going on in your own community, and try to get voted onto the school board, because that's where it's happening. Thank you again, everyone, for joining us, and have a great weekend, and stay warm if you're in a cold place. Thank you.